So the NICE guidelines, the British Menopause Society, the International Menopause Society, the North American Menopause Society, the Endocrine Society, all say generally the same thing about hormones and cognition, and that is that it's not an indication. Cognitive function is not an indication for hormone therapy. You take it for vasomotor symptoms. And this study does nothing to change that recommendation, I think, whatsoever. It's in line with other recent observational studies and has all the weaknesses of observational studies. So it in no way should change clinical practice. If anything, it's an opportunity to discuss the importance of cognitive function in midlife women's health and the importance of treating menopause symptoms when they occur.